Are you vaccinated?
Yes.
And both of us, we can take that off. You don't have to have it on. You can
Thank
take
you.
it off. Yeah, I know. Now, tell me about your life before the surgery.
I was always a very active guy, but a year before, the pain that started in my left buttock radiated down my leg like sciatica pain, got to the place where literally the pain was so bad that nothing would touch it pain-wise, medication-wise. So
You
I
used
had no alternative.
you used the sentence that it would lay you on the floor.
Yes,
Literally?
literally on the floor.
Yeah.
You had recommended trying some injections.
So we did conservative management, and that failed.
It all failed.
That
yes.
all failed.
It all
Now,
failed.
the surgery was 5 months ago, right?
Correct.
Do you remember the surgery? How long did you stay in the hospital?
I was in the hospital for just over 24 hours.
Yeah, you just one night. You stayed
One
in
night.
just one night in the hospital.
Yep.
And I have the record of the surgery. It was 90 cc of blood loss and 89-minute my time skin to skin.
Right.
And we did actually a 3-level fusion, L3 to S1 fusion. And there we put, and here's your thing. You had a scoliosis, you have a spondylolisthesis. So what we did, we put 3 spacers in. And we
Is there
lifted
still
up.
scoliosis from what you can see, doctor?
It's much better though.
Yeah. Okay.
Now look at that. This is we call osteophyte here,
Yeah.
the bone spurs.
Yes.
And actually, I had to traverse that bone spurs to get the job done. And here, what you see is that now that it's lifted, and the hole where the nerves are coming out are wide open. And 5 months later, the bone is growing in the front very clearly. And here is the side view where we see the screws. They're exactly where they need to be, doing exactly what they are doing, which is holding you still. And look at that, bone is pretty much growing around them. So we are pretty far advanced because we didn't have to destroy your back to get the job done.
Right.
Do you mind to show us the incision on your back?
Sure.
And this is all what we did. So if you hold it up, I put all 3 spacers through this hole, and then I put the L3 screws here, L4 screws here, L5 and S1 screw go through this combined hole, and then this is to put the rod in across. And they're going to fade even more. In a few months it will be even hard to see. Now, most important question, that leg pain that would put you on the floor, how is that now?
It's gone.
It's completely gone?
Yes.
When did that go away?
From what I can remember immediately when I came to after the surgery.
You woke up and that pain was gone. That
Yes.
was putting you on the ground.
Yes.
Okay, and that with the surgery that was 1.5 hours and
Yes.
90 cc of blood loss. So that is a proof that what we call anatomic decompression or physiologic decompression works, and we don't have to direct decompression, which means we literally then have to take all this bone off here and open up, take all this bone off here. That's a very invasive procedure, and that's why it takes 8 hours to do that versus 1.5 hours to do that. I just don't have to do all of that.
Right.
So far, happy with the result? What do
Very
you think?
happy with the result, and I've already recommended this procedure and you to other people.
Thank you, I appreciate that, okay? Thank you so much for the interview.
Thank you.